Welcome back, or welcome if you're just joining us. This is the France 24 debate. We're asking how to stop Ebola. This in the wake of news in the U.S. of a first case contracted on United States soil. A man who left Liberia on September the 20th. His condition listed as serious. With us to talk about it from Monrovia, Carlo Nino, Logistics Director of the Ebola Crisis Response Team at Global Communities. Here in our studios, Dr. Jan Cedric Hansen, who advises the West Africa Health Organization, a regional body. Jean-Philippe Carpentier, attorney who focuses on sanitary risks, and France 24's correspondent Caterina Vitozzi, who is in Accra, where on Tuesday there was the inauguration of the new command center for the United Nations. We're going to talk about international coordination in a moment. First, though, I want our panel's reaction to the words of Liberia's president, Ellen Johnson Sirleaf. Earlier, speaking to France 24, she staunchly rejected the Center for Disease Control's projection of as many as 1.4 million cases of Ebola in the region by January, adding that even by the UN's projection of 20,000, that is too high.
We now realize that we're beginning to see stabilization in a few of our political subdivisions. Even in Monrovia, which has been hardest hit because 1/3 of our population reside in this capital city. Even here, we begin to see a slowdown in the number of people that are reporting to the treatment centers.
Carlo Nino, in Monrovia, do you sense that stabilization that Liberia's president is talking about?
That is indeed occurring. What we have is we do have some emergency operations centers that are here in Monrovia, where you're having several of the NGO communities coming together and coordinating all of their effort. So that way we don't have everybody doing redundancy of effort or overlapping or misinformation or miscommunication. So we do have a centralized command and control mechanism that is here in Monrovia that I would think is leveraging all of its skills against the spread. And therefore, any numbers that are being misrepresented or any numbers that are not being that are coming into our COC, our Command Operations Center, are being collated in one location. So that way we don't have wild numbers going in various different directions. And that's what I think might be contributing to some of the high estimates from CDC.
All right. Let me ask you about this, Jan Cedric Hansen. Those numbers, 1.4 million from the CDC. She's even saying that the 20,000 cases to be expected from the World Health Organization is too high.
Well, our projections, because we are working on the epidemiological data that the West African Health Organization sends us and share with us, shows that the doubling time for the number of cases is roughly 27 days. So each month you double the number of cases, cumulated cases.
Cumulated cases, well, we're a little over 6,000 right now for all of West Africa.
Absolutely. So next month should be 12, 24 within 2 months. And we should reach 50,000. This is a reasonable figure. Cumulative cases doesn't mean there is that much number of healed people at the same time, because when you contract the disease, hopefully only 50% of people die of the Ebola, as opposed to 90% from the previous outbreaks. So it's a weak Ebola, if we may say so, this time, which is a chance.
And why? Because they're reaching...
Because it is actually disseminating among humans, and it is a common law regarding viruses that when they jump from one individual to another individual, they become weaker and weaker. And it is a common law to observe that with time, the death rate or the attack rate of a virus decrease. It doesn't mean that the virus doesn't spread, but it says that it is less visible.
All right, so you disagree then with Ellen Johnson Sirleaf when she thinks that the WHO's numbers are an overestimation. Caterina Vitozzi, let me ask you on this. What's the projection from that UN command center in Accra?
Well, they quoted yesterday those CDC figures, but stressing that the 1.4 million cases by January would happen, were the projections if there wasn't the correct level of international response. So those are figures that the UN mission here say won't happen now that there is this much more political mobilization, that the resources from the international community are starting to galvanize, coordinate, as Carlo said, to make sure that there is proper management of all the resources that are coming in. So those are still the figures that the UNMIR mission are working to here. I think it's also interesting to look at the timing of President Sirleaf's comment. You would seem to think that, you know, just a few weeks ago she was asking for much more international assistance. So it seems to me quite interesting at this juncture to perhaps suggest those figures are maybe inflated. It could be a case of she's trying to mend some bridges within her own country, for example. There is a lot of criticism about how the government has been handling this situation. So if you've got headlines in newspapers across Monrovia saying there's going to be 1.4 million new cases of Ebola by January, that is something very clearly that the president's going to want to sort of rationalise, put into context, and sort of trying to keep some degree of calm in Liberia.
All right, reactions coming in to us. This one on Facebook from Jason. We have a travel embargo with Cuba. I suppose he's from the United States looking at this comment, because we don't have a travel embargo here. Why do we not have one with these countries now too? Is a travel embargo what's needed, Jean-Philippe Carpentier?
Well, it's not very easy, and it tackles a few issues. First of all, we've got a right to travel, and that's something which is very common in our Western world. So at the moment, it is not foreseen that this right shall be diminished. So people will be able to travel to Africa, and this helps spread the disease, which is a real problem. This right to travel relates also to the migrants, and migrants, some are controllable, and some are not. You've got all the illegal migrants from North Africa that come through Morocco and then arrive at the border of the European Union. And this one is not really controllable, and it helps spreading the disease. And the last thing that
right, but there's been no cases, we should point out, there's been no cases
no,
so
there's
far
been no case so far.
of Ebola coming through migrants.
Of course, there is no case
Africa.
so far. But as long as the disease is spreading, the risk that some cases arise that way is getting bigger.
Right, so there's a risk there. Okay, so that's the legal answer. What about the medical answer? Do we need to put a ring fence around West Africa?
No, I think it's the ring fence is not the solution because of legal aspects, but from medical point of view. What is wise is to check people and to make sure that anybody who has a fever, because as long as you have no fever, even if you've been contaminated by Ebola, with no fever, you are harmless, totally harmless for yourself and for your relatives and anybody you will meet. So what is important is, as long as you have a fever, check whether this fever is real or not, and seek advice from a healthcare professional who has been trained to recognize Ebola and to decide whether you are a suspect case or a confirmed case of Ebola. And then enter the process to being isolated and put in quarantine, and check all the people you've met as soon as you are with a fever, and then you can quarantine all the contact people, and then you can control the disease. It won't be, I mean, if you try to close a border, especially in West Africa, I mean, you have...
It's not going to work. Let's pick up on that point.
It won't work at all.
Let's pick up on that point, because there was a 3-day lockdown in Sierra Leone, and then last week, the announcement that 5 of the country's 14 districts were under quarantine. Now, in the northern city of Port Loko, near Guinea's border, the population is, well, skeptical.
Since the emergence of the Ebola crisis, people are afraid to come and sell to us. And they're also afraid to come and buy. Before, when we went to market, we were able to buy goods cheaply. But now, since they're taking a risk to come here, the goods have become very expensive.
Port Loko, in fact, is a very, very big area, and it's a mining, the mining activities in this area are very, very wide. So the security, there's going to be some hiccups here and there in terms of security. But I believe our police officers are up to the task.
Caterina Vitozzi, this placing under quarantine of entire districts in Sierra Leone, how's it going?
Well, there have been some suggestions, well, depending on which side you look at it, I suppose. The government have said that it's absolutely necessary, and then it's giving health services an opportunity to conduct these house-to-house searches to make sure that if there are any sick people residing in homes who are perhaps too scared to go and seek treatment, that they are found. However, at the same time, you have aid agencies who continue to say that quarantines and lockdowns like this are simply ineffective, I should say, and that the people conducting even the house-to-house searches, they don't have the right sort of expertise in order to make sure that the people within them, the people that they're checking, do have the right symptoms. And in some cases, there have been reports that people who indeed are showing a fever and some similar symptoms to Ebola, but in fact, perhaps they're very similar symptoms, as I'm sure Dr. Hansen will say, they're very similar symptoms in the early stages to signs of malaria. So aid agencies are saying that some people could be being put at undue risk, moved to an isolation ward or a holding centre for Ebola, perhaps only when they're showing symptoms of an equivocal illness in its early stages. So both sides of the spectrum suggesting that the lockdown maybe isn't as effective a treatment method as could be hoped.
All right. And Carlo Nino, by the way, you're on the front lines of all of this, since part of your work as logistics director for Global Communities is helping to try to bury the bodies, and that's proving to be a difficult task in Monrovia these days.
Yes, there are some challenges. I mean, one of the ones that we've run into is to be sure you have to have the right personnel on the ground that are going to be trained and know how to put on the personal protective equipment, the PPE, what is the right order of operations for donning and removing that equipment, and then what are going to be the burial procedures. But also don't neglect that the teams that are going to be burying within these communities, it should be like for like. We've had some Muslim communities that did not want to have non-Muslims burying their personnel. So therefore, we had to have Muslim personnel trained and put up to the task of these burial procedures. Otherwise, these small communities where they were pulling their dead and setting them aside and hiding them, which again became a vector for the disease. So again, this goes back to having the right people and having the right mix that's out there. But yes, it is a very sensitive task, and we have a lot of intensive training that goes through all the cultural aspects and treating everybody with dignity and respect, despite the fact that there are large numbers of persons that are unfortunately succumbing.
And last month, Carlo,
yes,
we saw, last month on that point, Carlo, we saw there were riots in the Liberian capital when they tried to quarantine one of the working class slums there.
Sure. Again, I think it really goes back to everybody needing to know exactly what Ebola is and what it isn't, and then what is the communication piece? What is that? What does that look like? And so on the radio, on any given radio station here, in any of the different indigenous languages, Kron, Kru, Mandingo, they are discussing it over the radio stations to the personnel, the people, the population, what Ebola actually is supposed to be about for those who perhaps have illiteracy or any other issues, or they can't have access to the information of what Ebola is, to try to reduce some of those tensions so that the aid workers can perform their act. But the one thing I wanted to point out is that another area of concern is we do have these centers where we do remove those who are infected with Ebola from the community. We have the care centers that are where we take the infected and we put them there, and we try to give them assistance and give them relief. Well, unfortunately, those have been viewed upon by some of the local communities as quote-unquote death camps. They look at them as, and that's the wrong optics. Those are the wrong optics. Where
you're broaching there, Carlo. Carlo, you're broaching there a key point of debate inside of the medical community. They've been touted by the U.S. Center for Disease Control. Maybe we could just show our viewers for 1 sec on that. Medical journals has been playing out as a battle between doctors and epidemiologists. The effectiveness of these treatment centers that you mentioned, they're touted by the U.S. Center for Disease Control, which in a nation like Liberia, where the hospital system is all but collapsed, the CDC saying it's the way forward to stop the spread, arguing for the doctor's side. The French charity MSF, whose director of operations, told the Washington Post, this is not going to work. To move people in an epidemic is a big responsibility, and it requires huge logistical capabilities. Otherwise, they could turn into contamination centers. So let me ask you, Carlonino, so far, have these treatment centers turned into contamination centers, or are they the way forward to helping thwart the disease?
They are a model. They are a model that we use and are implementing right now, but it's up to the local communities to implement those. If the local community there resists that or does not want to implement that, then nobody's going to make them. Nobody forces them. At the same time, however, there are amenities that are brought into those centers, but it's not spreading the disease from those care centers. It's not. They're like small isolated wards that are separated from that local indigenous community that are set aside.
Let me ask you, Dr. Hansen, these treatment centers, are they a good idea?
Well, for the handling of suspected case, potential case, and actual cases, at the French Society for Disaster Medicine, we are actually thinking and working on proposing alternative organizations which are based on triage of victims, because what we are facing right now is amount of victims or potential victims which overwhelm the healthcare system, whatever the MSF or the local government healthcare system. And when you are facing such a shortage of resources compared to a vast amount of victims, you need to set up a triage to optimize the dedication of the armamentarium to the best patients who have the best chance to survive. So right now, what we should focus on is identify clinical elements that actually anticipate the outcome of the disease for an individual, and see this guy seems to have a best case scenario and he will survive most of the time.
So what you're saying, in other words, is that there should be treatment centers, but maybe treatment centers for various levels of the disease.
Absolutely, and we should identify patients that are potentially developing a dreadful disease from those who, once again, only 1/2 of the patients die. So that means you have minor onset of Ebola now, and those don't require such a big take care,
right,
if I may say so.
That brings us back to a point that Caterina Vitosi touched on a short while ago. Caterina, we were talking a little bit about the fact that the UN has set up this command center for West Africa, but what we're seeing on the ground is that Liberia, which was founded by freed U.S. slaves, well, they're getting the U.S. military to come in. The French are setting up field hospitals in Guinea, a former French colony. The British are helping out in Sierra Leone. So projects such as these treatment centers, I suppose, are not getting the same kind of voice according to which nation you're in.
Absolutely, and I think what the UNMIR mission has set out to do is really act as an enabler. Now, that means they're not going to go into these countries and set up and run treatment centres or community care centres, but what they're going to do is provide even simple things like the petrol, so that the petrol for trucks who are taking medical supplies across the country. It's also important to remember that the US announced their big plans. The French military hospital announced that it was going to be opened in Guinea. Ditto, the British government going into Sierra Leone. That was all announced before the UNMIR mission got the go-ahead after the UN General Assembly. So the UN mission is really going to be trying to effect a sort of overview. It'll enable all these agencies to come together so that there isn't prevent any mismanagement, as Carlos said. I think that is really crucial with what NGOs I've spoken to say that every person that is giving resources, that those resources are used most efficiently and they're used in the areas that need them most. So it's really the UNMIR mission here is going to be an overall management, a coordinating body, and it's going to provide a lot of manpower and logistics as well.
And is the UN staying neutral, if you will, when it comes to this argument over whether or not there should be these containment areas, these centers for Ebola patients?
Well, the UN has always really followed until now, or specifically the UNMIR mission we were hearing yesterday, are following the guidelines of the World Health Organization. And the World Health Organization from the get-go has always been very clear with regards to keeping borders open to allow sort of free passage of people. They say that shutting borders just encourages people to hide and to go underground. They haven't really made an official comment with regards to the community care centres. Now, this is obviously something that's being championed by the US and being set up as a model, as Carlo mentioned earlier. The UNMIR Chief of Staff, I must say, has been in Liberia today, and he's been meeting with a whole range of actors. No doubt conversations about those community care centres will be on the agenda. If they need support and they think that model is the one to push, then the UN is committed to providing the logistics to support them properly.
All right. I want to thank you, Caterina Vitozzi. Caterina Vitozzi, who's been reporting throughout, ever since the start of this outbreak of Ebola. I want to thank as well Carlo Nino, who's on the front lines there with his group Global Communities in Monrovia, and our guests in the studio, Dr. Jan Cedric Hansen and Jean-Philippe Charpentier. Thank you for being with us here in the France 24 debate. We're not quite yet done because we have to say hello first to James Creedon.
Evening, Francois.
And James, Ebola, now this first case contracted in the United States, setting social media alight.
That's right, and indeed some sensationalism in some of the American media. Francois, we'll take a look first of all at the New York Daily News. A plague like no other, says the headline. Americans panic over first US diagnosed Ebola patient. And you can see there a photograph indicating, I suppose, the risk of contagion. Also on Twitter, I'm so scared of this Ebola stuff, says one Twitter user. Over at USA Today, you have a headline, again in the same vein, Ebola outbreak, 5 things you need to know now. All of that indicating that there's a huge risk that this could spread broadly. Now, I think a little bit more measured and perhaps more responsible is the message coming from NPR Radio, the public radio service. The message on Ebola, don't panic. So I guess people listening to NPR...
avoiding scaremongering is important.
That's right. If you're listening to NPR and reading the New York Daily News, you might be a bit confused. But the NPR's Richard Harris this morning, for example, said that even in terms of flights, there was one known case of an actively ill patient going from Liberia to Nigeria. And even on that flight, no one contracted it from him. So perhaps no need to panic, as the headline says on NPR. Similar message coming from the Centre on Disease Control on their Twitter page. We know how to stop Ebola through case finding, isolating sick people and contact tracing, says that tweet with a video accompanying it. The White House also very much on that message. Ebola cannot be spread through air, water or food in the US. Learn more about the facts, and an infographic essentially with the same message. So you can see very much an effort to calm those who might be worried about a broad contagion. Now, I suppose looking at how this has been covered in other Agence France Presse, the French news agency in French, they're showing in that infographic there that this is indeed the first case outside of France. Some concerns as to why the Centre for Disease Control hasn't been speaking about the patient's flight itinerary, concerns that he might have come through Europe. Could this, did he fly through Brussels?
He came via Brussels, yeah.
Right, which was seen as one of the possibilities. And this maybe has contributed to some in the French media, such as the Nouvel Observateur, wondering, could France be affected by a similar case? I suppose with lots of flights to and from West Africa, that is a concern. And some experts are saying, look, it could happen. We can't rule that out. Other buzz about this in the French media, you've got concern that Mecca and indeed the pilgrimage coming up in Saudi Arabia with countries affected such as Nigeria, even though there seems to be indications too in Slate.com that Nigeria might now have the all clear. But with so many people moving for such a massive pilgrimage, there are concerns that that could lead to an increased risk of Ebola spreading, Francois. So that's just some of how this has been covered in the US and French media.
All right, James Creed, many thanks. There's much more in Media Watch here on France 24. Again, thanks to our panel and thank you for joining us here. There's much more to come on the top of the hour here on France 24.